So you heard that big mouthful. EMDR stands for eye movement desensitization reprocessing, and it helps people heal from distressing and traumatic memories using back and forth movement, often called or referred to as bilateral stimulation. With kids, and honestly with grown-ups, I just say back and forth movement. It's easier to understand. EMDR is recognized by the World Health Organization as one of the top trauma treatments, and it is used worldwide across several different countries and different cultures. When Francine was interviewed about EMDR, she said that if she were to go back and rename EMDR therapy, she would have simply named it reprocessing therapy. But by then it was too late. EMDR had already stuck. The name had already caught on. I'm going to invite you to use your interaction now. Give me a thumbs up if you've heard of EMDR before, experienced it before. Maybe you saw it on TikTok, Miley Cyrus. Maybe you saw Oprah and Prince Harry or Meghan Markle talking about it. You've heard about it somewhere. Okay, so I have a few thumbs up. Great. The information, and I love that celebrities and people are starting to talk about EMDR and how it has been useful and helpful for them. But I want to acknowledge there are also lots of common misconceptions about EMDR out there. So I'm just going to do a little overview of the most common ones and give you some fun facts. The first thing I often hear is EMDR, that's just moving your eyes, right? You just move your eyes back and forth and you feel better. The reality of it is, while moving our eyes or moving your eyes are one part of EMDR, they're just one form of bilateral stimulation. We're going to learn a lot more about some other types throughout today's presentation. And EMDR is actually an entire comprehensive treatment model, and the eye movement and bilateral stimulation is just one part. And actually, here's another fun fact. Did you know that when you go to sleep, your eyes move rapidly back and forth? It's called REM sleep. So that rapid eye movement is a cycle of sleep. And during REM, our brains become very active. Our eyes move back and forth underneath our eyelids. And REM sleep is often associated with vivid dreams and intense dreams. REM sleep is also considered essential for cognitive functioning, memory consolidation, emotional regulation, and creativity. It plays a big role in brain development. And so it is believed that the bilateral stimulation in EMDR may mimic this similar process in our REM sleep. Okay, myth number 2. EMDR is only for PTSD. The reality of it is, originally, the first research study ever published on EMDR was done on veterans with PTSD. However, since it has been discovered, it has found to be really effective with several other populations and several other mental health problems for both adults and for kids. Well, you're here because the title of the presentation is EMDR for kids. And one of the common misconceptions, even in the EMDR world, I just went to an EMDR conference and had a booth with my books and information and resources for EMDR with kids. And there were adult EMDR therapists who come up and say, I didn't know you could do EMDR with kids. So there is a myth out there that EMDR is only for kids. And what I will say is, in the beginning, like most therapy modalities, if you think about cognitive behavioral therapy, trauma-focused CBT, all of these other modalities of therapy are usually created for adults first, with the exception of play therapy. Play therapy was created for children in mind. Many of the other modalities are created for adults first and then later adapted for children. Because EMDR is newer to the field of psychotherapy. It's kind of like this toddler young child as far as treatment modalities go. We're still learning how to adapt it. Resources are coming out and research is coming out. But there are several EMDR therapists who have been adapting EMDR to be child friendly, combining it with play therapy, and combining it with really child fun techniques to get kids in towards their healing. I love hearing this one. Are you hypnotizing me? What is this EMDR? EMDR, I heard that was mind control or hypnosis. And that's a myth. So EMDR is not hypnosis. Whether clients are children or adults, they are fully aware of what's going on. They are actively participating in the process. While therapists guide and support the process, they're not implanting or removing any memories. In fact, a part of the EMDR protocol is we teach clients to have a stop signal or a stop sign to notify their clinician if they're feeling overwhelmed and if they want to pause the treatment and regulate themselves. So both clients, young and old, are really empowered in the process of EMDR and they get to choose when to start and stop. Right. Touch on the next myth that gets out there. EMDR is really effective and it is known to work fairly quickly. There are studies out there comparing EMDR and CBT and find that both modalities are very effective with children. And the one difference is that EMDR works within half the time in most of these studies. So if a child was getting trauma-focused CBT and for something really challenging, maybe it takes a whole year before they feel better. With EMDR, they might feel better within 6 months. EMDR can work instantly, but it really depends on the person and it depends on the type of trauma. So let's just think about this for a second. If I have someone coming in and their life is well adjusted and going well, but they just had a minor car accident that kind of spooked them, that's not going to take very many therapy sessions, period. Whether it's EMDR or any other type of therapy, it's minor. It isn't something that has been happening over a long period of time with high intensity, right? So if there is, like I say, a less severe trauma, EMDR can usually work fairly quickly. But as we know, so many of the children that we work with today and so many families that we interact with now have such complex trauma. So EMDR could take a long time, and it just depends on how intense and chronic the trauma has been. Here's the last thing, and hopefully the takeaway that you will have after today. EMDR is only for working on problems. So EMDR, the main standard protocol is specifically for what we call in EMDR a target problem or the main presenting problem that we want to work on. But there are also several other protocols within EMDR that can be used as what I like to call with my children feel good EMDR. So there are protocols and exercises that you could do to feel better and feel good. We're going to get an experiential today, so hopefully you'll get to see what that feels like, but there are protocols such as safe calm place or resource developing, so really learning how to have more confidence or feel more patient or feel more courageous or in control. We do a lot of things in EMDR to help people enhance their coping skills and enhance their ability to regulate and feel more stabilized.